Hello, this is Dr. Gay from First Lake MRI, and this is a 58-year-old female who stretched her leg doing the splits accidentally out on a boat and felt pain in the back of her buttock area and her proximal thigh. She had hemorrhage back there, classic signs for a tear of the hamstring tendon. So we did an MRI here to look at the hamstring tendon to see if it was a muscle tear that can heal fine, or if it was a tendon tear that may not be able to heal very well. And on this view, we can see some arrows pointing to where the hamstring tendon should attach here on the right-hand side. This is the pubic ring on the right. This is the ischium, comes down here. This is the left ischium, called the ischial tuberosity, where it pokes out here. This is the left hamstring tendon, one of the three tendons that attach here along this bottom margin on the left, which looks normal. On the right-hand side, though, if I can find my arrows, doesn't look quite normal. Instead of seeing this nice dark tendon coming down here, like on this side, we see fluid in this crazy looking area of intermediate to dark signal, and these areas of bright signal. This is a big hematoma. So the hamstring muscles are down here, pulled back 1, 2, 3, and they come up here, and this is part of the hamstring tendon. The tendons kind of blend together, hard to tell apart. But we can see that this is the tendon that ends here. It does not go way up here to attach. And we're going to look on a side view in a second. This is another view where fluid stands out bright, all the same as this one. You can see the fluid, these intermediate irregular areas, amorphic regions of intermediate signal, and lobulated. These are all clotted blood products in here. And this is that muscle that's pulled down. They also have a tear, excuse me, of this right here. This is called the gracilis muscle. The gracilis comes off here at the bottom of the pubic ring. I think I can see it better on this side. Here we go. The bottom medial margin right here. And it comes down, 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 down. It's one of the pes anserine tendons. And it's a little bit foggy on the axial images. We can see a longitudinal tear of that. And it has edema surrounding it. So the gracilis is partially torn, strained. You can see this foggy brush-like area of brightness within the adductor muscles. These are all the adductor muscles that come sideways here, off from the pelvic bones, out here to the femur. And the adductor muscles are partially torn or strained here. So this is an adductor muscle strain, a ruptured hamstring tendon that's retracted back with a big hematoma, and that cannot heal because it's too far away. So they're going to talk to her about surgery. And they also have this partially torn muscle here, the gracilis, which is again part of the pes anserine tendon complex. Now, interestingly, I almost never mentioned the gracilis. I almost forget it exists, but I saw it in this case, and then earlier, I had another case of the distal gracilis. I'll show that one here. But before I do this, I want to show a sagittal view, side view of this. This is the front now of the thigh, back of the thigh. The buttock would be up this area. This is that bony protuberance, the ischial tuberosity. And we see this glob down here, the hemorrhage. This is the muscle back here. And this is the tendon. You can see the muscle down here. This is one of the tendons coming up here, making a little loop. Coming up here, and here's the torn tendon end, this glob here. And again, it should attach right up here on this bone, bony ridge. Instead, it's pulled back down to about here. And now we're going to look at the distal gracilis. Again, this is that gracilis coming off here, off the middle. Here's the origin. It's coming down, down, down. And now this other patient I had today had this, quite an abnormal gracilis tendon. So the muscle comes down here, and here's the tendon. And this is markedly thick. I've never seen this before, but it looks like a very peculiar chronic hypertrophic tendinopathy, very thick, irregular gracilis. We see these 1, 2, 3 pes anserine tendons here. This is the sartorius muscle here, gracilis, and this is the semitendinosus there, but a very unusual case. But here's the distal gracilis and the proximal gracilis here for a little anatomy review. And that's it. Thank you very much.